Hi, my name is Louisa and I'm a health educator at MaineGeneral, specializing in harm reduction. This series of presentation covers specific injection-related injuries, and today I'll be talking about cotton fever. So what is cotton fever anyway? Well, sadly there hasn't been a whole lot of research into cotton fever. It's usually described in a way that's similar to a really bad flu, and it can come on as soon as 20 minutes after you inject. A telltale symptom of cotton fever is extreme chills, or the shakes as they're sometimes called. You'll also probably have a high fever, muscle aches and pains, and potentially nausea. But what even causes cotton fever in the first place? Germs introduced into the bloodstream from bacteria on cotton fibers or dirty hits are likely to lead to most symptoms. A natural bacteria lives and grows on cotton, so if a piece of cotton ball breaks off while you are filtering and gets injected, the bacteria on it will go into your bloodstream and could cause you to feel the symptoms of cotton fever. The risk of cotton fever increases if filters are reused. Old cottons or makeshift filters, such as old cigarette filters, can be hotbeds for germs, and when you reuse them, you inject added bacteria into the body. Dirty hits are also a potential cause of cotton fever. This is when an injection is unhygienic. This could happen if you don't clean your hands or the injection site before injection, if works or needles are reused, if the injection site is blown on before injection, or if you touch the tip of the needle before you inject. All of these actions could leave room for germs to travel into the bloodstream and cause sickness. To avoid cotton fever, you should always use fresh cotton as a filter and practice hygienic needle use when you're getting ready to take a hit. To reduce the amount of germs you could be injecting into your bloodstream, always use a fresh cotton for filtering, if you do choose to use a cotton. Small cottons are ideal, as they're ready for you to use so you can avoid tearing the cotton on your own and potentially contaminating the filter with your fingers. At Next Step Needle Exchange in Waterville and Augusta, we offer cottons in both small and large sizes. You should also remember to keep your injection hygienic. You can do this by washing your hands and cleaning the injection site with alcohol wipes before you take a hit. You should also avoid blowing on the injection site or touching the tip of the needle before you inject. Always, if you can, use a clean needle for each injection. To help you practice hygienic injections, we offer fresh needles, tins, alcohol wipes, and more at Next Step Needle Exchange. If you do think you are coming down with cotton fever, don't panic. Although you might not feel great, most of the time it isn't serious. Don't shoot up again because this might actually make you feel worse. Instead, monitor your symptoms, grab a blanket, and try your absolute best to stay calm, as the fever usually passes within a few hours. But if you're still feeling sick after about 4 hours, you should seek out medical attention, as you might have blood poisoning. At Next Step Needle Exchange, we offer a variety of supplies like cottons, needles, sterile waters, tourniquets, alcohol prep pads, BZK pads, and triple antibiotic ointment. These materials help create a safer, cleaner environment for drug use, reducing the risk of infections and other complications. Thank you for joining me today, and I invite you to check out more of our content on MaineGeneral's Harm Reduction YouTube playlist.